Hi everyone, this is my community project, James Island, South Carolina. In this presentation, I will lay the foundation for the project I completed through a description and infographics. As you can see, I've chosen James Island as a community to base my project on. My project is on the mental health needs of the community based on the key habits of exercise, nutrition, and sleep. I will provide information on how the community can adjust behavior in order to better these habits in a very simple, not to be confused with easy, way. Throughout this project, I leaned on a nurse practitioner for support and guidance, named Rodney Andrews. The importance of understanding the community you are working with should not be underemphasized. Identifying community-driven priorities to improve health outcomes is crucial towards achieving health equity. Learn about the community to see where the need is, figure out where the community lies, figure out where the problems lie and what the community values, as something you interpret as a problem may not be in another group's value system. We should not impose our own priorities if they are not shared. If the priorities are shared, the outcomes has a greater potential to be sustained. James Island is located within the city of Charleston. Charleston is separated into downtown, West Ashley, and James Island. James Island is a town of 12,109 people. People are diverse in age and race. There is a strong surfing community of which the majority are white male. James Island has many beautiful parks, schools, and a short drive to the beach. There are several places to dine out, a movie theater, and a small nightlife scene. There is ample access to health care via primary care, urgent care, and specialized clinics. This is my windshield survey. To highlight a few things, James Island is covered by organizations such as James Island Community Outreach. They provide food, clothes, and medication to the public. There is a strong presence of police, fire, and EMS personnel. Continuing windshield survey. Real estate is also very difficult to obtain as many are looking for property here. Most of the people who work on James Island work in food and beverage. James Island community values outdoor activities such as enjoying the county parks. The population is relatively stable and is the smallest population of the nearby cities. The population is mostly white, followed by black, and the most common age group is 35 to 54 years of age, whereas the least common age group is the 18 to 24-year-old range. The birth rate is 7.1%, and the top causes of death include heart disease, cancer, accidents, chronic lower respiratory disease, stroke, Alzheimer's, diabetes, kidney disease, septicemia, and suicide, in that order. I was lucky enough to work with a dual certified nurse practitioner. He is boarded as a family nurse practitioner and a psych mental health practitioner. He assisted me with the ideas and the execution of the project. He is giving our educational pamphlet to his patients and placing them in his medical waiting room to be browsed by anyone in the shared office space. I have also been in contact with the town of James Island and the Charleston County Parks and Recreation Division for their assistance reaching the public. The CDC, the U.S. Census, and James Island's town charts have been my greatest sources of data. My community is at risk of ineffective community coping among adults over the age of 18 in the James Island and Charleston area, related to a knowledge deficit on adequate nutrition, lack of exercise, and poor sleep. The plan is to reach as many people in my community as possible through sharing an educational pamphlet shown in the next slide. Rodney will place the pamphlets in his office to be read in the waiting room and brought home to potentially reach the family of the patients as well. This is the pamphlet we discussed in the last slide. A few simple, but again not easy, changes to improve your mental well-being. Don't procrastinate bedtime. Plan to get a minimum of 7 hours of sleep per night. Exercise daily. Use exercise as medicine. Reduce stress where possible. Pay attention to calories to avoid excessive weight gain. My proposed evaluation methods. Rodney will tell me over the coming weeks how receptive people were to the information and if his patients reported any change in habits. I will also look to see how often the pamphlets left need to be replaced. Furthermore, Rodney will ask for feedback on the pamphlets to find out if the topic was of value and written in an easy-to-grasp manner. In conclusion, if a community is to be assisted in any health endeavor, it is of primary importance to understand the community and its makeup as thoroughly as possible. The area of James Island has been identified as an area which has a problem with mental health as well as significant overall health issues, falling into the categories of mental health not good and physical health not good, but one study on the locale. This drove me to work with my partner, a nurse practitioner, to produce an educational product to be disseminated to the public, mainly through his medical practice, through a passive means of waiting room reading and active means where Rodney has decided to pursue this. I hope to reach the community via the town of James Island as well as the Charleston County Parks and Recreation Department, barring their approval. This project overall will be difficult to evaluate in terms of effectiveness, but the number of pamphlets given out will be used as a marker to indicate the level of success. In the future, it may be beneficial to narrow the scope of the audience I'm attempting to reach to provide more effective coverage and use any feedback given in terms of the perceived appropriateness and applicability to produce a better tool. Here are my references, and thank you for your time.